friends, this is Nishant Gautam, Associate Professor from the Department of Pharmacology. Today we will study about the pharmacology of coagulants and anticoagulants. According to your syllabus, this is the third chapter of your second unit, that is the pharmacology of drugs acting on cardiovascular system. Now let us overview about this chapter, coagulant and anticoagulants. So step by step we will study the chapter. First we will study the introduction of the chapter coagulant and anticoagulant. Then we will study the coagulation cascade, how the coagulation takes place. Then we will study the fibrinolysis, then the natural anticoagulants. Then we will study about the classification of coagulants, their pharmacology and their mechanism of action, and then we'll study about the anticoagulants. In addition to this, we will study about some of the newer anticoagulants and the pharmacology of newer anticoagulants. So, let us start this chapter with the introduction. Before starting this chapter, we have to know about the hemostasis. So, what is hemostasis? It is the cessation of blood loss from a damaged vessel. It is name suggested, hemo means blood, stasis means to stop. In short, over here I summarized step by step how the cessation of blood loss takes place. If any injury is there, then sudden vascular spasm is there. That means the wound is responsible for the vasoconstriction, which prevents the sudden blood loss. Then what happens? Due to this, there is the platelet plug formation is there. First, due to any injury, vasoconstriction is there. Then afterwards, suddenly platelet plug formation is there. Sudden this start of platelet adhesion to the injured area, how it takes place? Actually, this platelet adhesion is get exposed collagen of the damaged endothelium. There it get bind. Then this process of the cessation of the blood loss takes place by the formation of the blood clot by the platelet adhesion. The process is called as the blood coagulation, which is responsible for the hemostasis. Actually, this platelet adhesion is mainly followed by the platelet aggregation. Platelet aggregation takes place by losing their individual membrane and forming a gelatinous mass at the injured area. That is the platelet plug. And this platelet plug is initially in the loose form. Then after some time it gets tightens when it reinforced by the fibrins. Sometimes without injury and without followed by these mechanisms, the clot formation is there, is considered as the process called as the thrombosis. So what is thrombosis? Thrombosis is a pathological condition resulting from inappropriate activation of hemostatic mechanism. It is categorized into the two categories on the basis of their location. First one is venous thrombosis. Is usually associated with stasis of the blood. A venous thrombus has a small platelet component and a large component of the fiber. Point to be noted over here, in this the platelet components and the large component of fibrin is there. Then the next thrombosis is the arterial thrombosis, is usually associated with atherosclerosis, and the thrombus has a large platelet component. So what is the difference between venous thrombosis and arterial thrombosis? Here the large platelet component is there, and in venous small platelet component is there. So basic difference in venous thrombosis and arterial thrombosis is the component of the platelet, small in venous and the large in the arterial thrombosis. Then a portion of a thrombus may break away. Sometimes it breaks and travels and ambulus and lodge downstream, causing the ischemia or the infraction. So here I summarize the name and the numbering of the factors which participates in the process of coagulation. Just see in this chart the actual number of the factors are 12, but we numbered these factors up to the 13. Here see the sixth is not there. Wait a moment over here and search why it is so, and do remember about the name of these factors. Like the first factor is known as the fibrinogen, the second factor is known as the prothrombin, the fourth factor is the calcium, fifth factor is the proacetylene. Like that, just to start remembering the name of the factor along with their Roman numbering. So after this small introduction, let us start the study about the phenomenon by which the mechanism of coagulation takes place. In medical terminology, it is called as the coagulation cascade. In this, we will study how and with the help of what factors it is taking place. So, to study about the mechanism of coagulation or the coagulation cascade, let us concentrate on this flow chart. Here, how the coagulation is taking place is summarized. That is, the hemostasis means the arrest of the blood. Actually, it is a complex blood coagulation process which involves in the interaction between the injured blood vessel wall, platelet, and the coagulation factors. A cascading series of protein reaction is first started by the contact activation of the admin factor. See here from the intrinsic system in which all the factors needed for coagulation are present in the plasma. This pathway is responsible for clotting when blood is kept in a glass tube, and amplification of the common pathway. This is a slow process and takes several minutes to activate the factor 10. Just see in this chart, the 12th number factor become activated by the contact. Then this 12th activated factor makes the activation of the 11th factor, and this 11th factor makes the activation of the 9th factor. And this activated 9th factor in presence of the 8th A activated factor and in presence of or with the help of the calcium and with the help of the platelet phospholipids, it makes the activation of the 10th factor. On another hand, with the tissue thromboplastin, where the extrinsic system proceeds, it needs tissue factor but activates the factor 10 in the seconds. In the normal course, coagulation after injury to vessel wall occurs by this vessel. So, see here in the extrinsic pathway, due to this tissue damage, the tissue factors are there. Seventh activated factor is there, and calcium is there, and in presence of the platelet phospholipid, it makes the activation of the 10th factor. And further, the common thing in both this pathway, the subsequent events are common in these two systems and results in polymerization of fibrinogen to form the fibrin strands. And blood cells are trapped in the meshwork of the fibrin strands, producing the clot. Likewise, this coagulation cascade takes place. In parallel to this, fibrinolytic system also works. So, what is the fibrinolytic system? This system provides the check and balances so that clotting process does not go out of the hand. That means it makes the control on the clotting, natural clotting process of the body. It dissolves the clot at the site of damage once the damage is repaired. So, the process of dissolution of the clot is called as the fibrinolysis. As name suggested, the lysis or the breakdown of the fibrin meshwork of the clot. To understand this fibrinolysis mechanism or the phenomenon, just concentrate with this simple mechanism that summarized in this diagram. See, at the upper side of this diagram, intact endothelial cell lining is there, and downwards, see the damaged endothelial cell linings is there, above which the clot form is there. So what happens, how this fibrinolysis or the breakdown of this the fibrin clot takes place? First of all, at the endothelial cell site, what happens and how this fibrinolysis takes place? So the endothelial cells secretes tissue plasminogen activator, here indicated as a TPA, at the site of injury. This plasminogen activator or the tissue plasminogen activator get bind to with that of the fibrin and converts the plasminogen to plasmin, which further get digests the fibrin meshwork. And in addition to this, plasminogen activator inhibitors 1 and plasminogen activator 2 inactivate this tissue plasminogen activators to inhibit this process of the fibrinolysis. And in addition to this, the antiplasmin inactivates the plasmin, here indicated as alpha 2 antiplasmin, alpha 2 AP. Now we will study the mechanism of natural anticoagulant, how this mechanism or the phenomenon of natural anticoagulant takes place. We will study over here the prostacyclin PGI2, that is a metabolite of arachidonic acid which is produced by the endothelial cells, and it opposes the action of thromboxane A2, and so it inhibits the platelet aggregation and the release of the platelets. So both it inhibits the aggregation and the release of the platelets. Then on another hand, the antithrombin 3, that is a plasma protein factors 12, 11, 9, 10 and second. So this is how the mechanism takes place, or the phenomenon takes place in our body as a natural anticoagulant. In addition to the previous, further two more mechanisms takes place for the process of the natural anticoagulation. Here, the protein C, plasma protein, it inactivates factor 8 and 5, which is not blocked by the 83, and enhances the activity of tissue plasminogen activator. Actually, it is a vitamin K endogenous anticoagulant which is activated by thrombin through binding of its receptor, that is the thrombomodulin. And the another mechanism, in this mechanism, heparan sulfate, which is a proteoglycan related to heparin, gets synthesized by the endothelial cell, which serves as a cofactor, and it enhances the activity of the 83 antithrombin 3. So that's all for the day, and we will continue the part 2 of same chapter. Till that, have a nice day and thank you.